Thank you, Mr. Chairman. I want to thank you very much for the hearing. This is actually very fascinating stuff, and I want to thank our witnesses for their presentation. Dr. Smith, as a fellow Oklahoman, I am very impressed and very pleased with your business model. If I'm correct, you don't take any federal payment for any of the services. Is that correct?
Correct. We see Medicare patients, but we don't accept any money from the government.
Can you quickly tell us what were the reasons that you came to that decision, that it was really better from your standpoint not to be involved directly in something like Medicare?
There are just too many strings attached, going way back to how the Stark laws affect physician-owned facilities, all of which have very unintended consequences, and all of which would prevent a model, this successful model like ours. I also am a firm believer in that rational pricing emerges from competitive activity, and the idea that prices can be dictated from on high it's just wrong. I mean, the prices are either too high or too low. They're always wrong. If they're too low, then there's rationing, either soft or hard rationing results, and if the prices are too high, then you wind up with a bunch of stuff going on that perhaps is unnecessary. So to accept federal money is to legitimize that pricing, and we just don't do that. I talk to patients directly eye to eye, and if they're having trouble that month, I don't charge them at all. It's just the way my great uncle practiced. If in Chickasha, Oklahoma, if you just deal with people as individuals, and if they're able to pay our website fee or some portion of it, then we deal with them on an individual basis.
Do you think that the model that you have would be transferable to something like primary care or other branches of medicine as opposed to just elective surgery?
Yeah, primary care is probably the area where it applies most perfectly. And the direct primary care movement here in the United States is one of the most exciting parts of this free market movement, led by Dr. Lee Gross from Sarasota, Florida, and also by Dr. Josh Umber from Wichita, Kansas. His model is called Atlas MD, and it is the perfect solution for patients that have chronic disease management issues. Patients will pay a subscription price of $50 to $70 a month, and they have unlimited access to primary care. So for the diabetic, hypertensive with a foot ulcer that needs to be seen every 7 to 10 days, that's perfect for them.
That's amazing. Do you find that the model that you have is being replicated other places? Are there you get a lot of contact from other physicians or physician-owned facilities about what you do, and are you seeing this begin to spread at all?
Yes, we've started an association, the Free Market Medical Association, because it's become so wildly popular. People are interested in our model because it feels like the right thing to do, and then there are other people that are interested in the model because it scares them, and they've lost a lot of business to us in Oklahoma City. So the Free Market Medical Association is a very vibrant and growing organization. We had our last annual conference in Oklahoma City at the historic Skirvin Hotel and sold it out. I don't think we'll be able to have it there again. So it's a very vibrant movement.
It's amazing. Well, I'd love to contact you sometime and just come by and see your facility.
I look forward to it.
Very impressed. In the limited time I have left, Dr. Lindsay, if I could move to you, I actually chair the subcommittee where we do Pell Grants. So your testimony was wonderful to me. And let me ask you this. One of the things we see as a problem sometimes is that a lot of states really have pulled back in the degree to which they support students, and a lot of that cost has shifted to the federal government. Does your experience suggest that's the case?
Yes, sir. When you look at the numbers, as the role of the federal government has increased, the contribution that states can make has decreased, not only because the federal government has taken it over, but also because the states have big items in their budget, such as Medicaid. So here you have two federal policies dueling with each other.
That's it. Excellent.
Excuse me, member, but the causation runs the other way.
Well,
It's the
ask
state.
my questions I'm about out of time here, so I would prefer to choose the witnesses I'd like to question. Thank you very much. I am out of time, so I'll yield back. But thank you, Mr. Chairman. I want to thank our witnesses.